welcome back. So now I'm going to ignore this side of the board for now. I'm just going to be explaining the control of blood flow. So in this lecture, we need to understand how the blood is controlled in the different tissues of the body. We also need to understand the difference between acute blood flow control and long-term blood flow control. And then we need to understand some humoral factors that affect blood flow. So for starters, by different tissues, I'm understanding that he means like when your tissues are being exercised or when your tissues are inactive. So active versus inactive tissue. So if you have an increased metabolism of an organ, you're gonna have increased blood flow because that organ is going to need additional oxygen and carbon dioxide additional oxygen coming in and additional carbon dioxide going out. It's going to have a faster metabolism and it's going to need a faster that gas exchange. So during exercise, we can understand that our muscle fibers are going to have increased metabolism and that is going to increase our blood flow. So for muscles and specifically our active muscles during exercise, we are going to be able to increase metabolism by 60-fold and therefore increase our blood flow by 20 times. And then obviously if we have increased metabolism, like I've been saying 15 times already, you have an increased flow. That means that if you have inactive muscles with low metabolism, you're gonna have low blood flow in those muscles. Now we're gonna go into that idea of acute versus long-term blood flow control. So acute, you can see this happen within seconds to minutes, and then long-term, it's in the name, it's gonna happen within days, weeks, maybe even months. So the acute blood flow control is going to be achieved by the rapid changes in local tissue by vasoconstricting and vasodilating. That's how you're gonna get that fast change because the blood vessels are gonna either constrict or dilate very fast. And then this can be caused by either an increased tissue metabolism, like I said, or a decrease in oxygen. When you have a decrease in oxygen, the professor, Dr. Francis, repeated 15 times that you need to know that oxygen is a powerful vasoconstrictor. So if you do not have this oxygen, then I'm assuming that we're going to vasodilate in this situation. And then vice versa, if we have acute, which is fast, we have one that works long term. This long term, the way we're going to affect and change our blood flow is actually by increasing or decreasing the actual size of our blood vessel. The physical size and number of the actual blood vessels going into that tissue and supplying it. So that's why it's gonna take a lot longer because we're not only changing the physical size, but we're also increasing or decreasing the number of blood vessels that are going to supply that tissue. However, it does take a longer time, but it does have a better control of flow in proportion to the needs of that tissue. And then our last topic, which is our last objective for this lecture, is going to be the humoral factors. So that's going to be the regulation by substances that are secreted or absorbed into the body fluids. So these can be either hormones or ions. Okay, so we have some vasoconstrictors and vasodilators. I listed them here because he did say that he was going to ask a question like, which of the following is not a vasodilator? And then he'll probably shove one of these in there. It's not a vasoconstrictor, sorry. And then he'll probably shove one of these in there and you have to pick out which one is not the vasoconstrictor and which one is not the vasodilator. So over here we have vasoconstrictors and I put energy and vision elevate, energy and vision elevate. And then on this side, the vasodilators, be strong and have purpose, be strong, have purpose. And then, so we're gonna have epinephrine, norepinephrine, we're gonna have angiotensin, vasopressin, and endothelin. And then for your vasodilators, you're gonna have the bradykinin, serotonin, histamine, and prostaglandins. And then those are our hormones themselves. Now, when we go into ions, it's kind of easier because calcium is the only vasoconstricting ion. However, on the other hand, we have some more vasodilating ions. So that's going to be your potassium, your magnesium, your sodium, your carbon dioxide and even hydrogen ions are going to be your vasodilators. And then osmolarity can also have a role in humoral effects with your blood flow and changing it. So basically, humoral effects is just your hormones and your ions and how that either vasoconstricts or vasodilates your vessels. We're gonna have the acute and your long-term. Acute is fast because you're just vasodilating or vasoconstricting. We have long-term, which is you're actually changing the amount and physical size of those vessels, but this one is better even though it takes longer. And then just the different tissues and their different needs, like active tissue when you're exercising, better increased metabolism, increased blood flow, and then inactive tissue when you're not exercising, decreased metabolism, decreased blood flow. And that is the lecture for control of blood flow. Thank you for watching.